GLP-1 medications are extremely popular and for very good reason. They are extremely effective and overall well tolerated. And I have many videos and podcasts about GLP-1 medications. But today we're going to talk about the first generation obesity management medications. These were our first options for treating the disease of obesity, and they are still available today and may be a good fit for you. So today we're going to talk about what those three medications are and who they might be good for and when we might want to use them. For those of you who don't know, my name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I see patients in Missouri through my telehealth practice, Missouri Metabolic Health. Before we go into the three first-generation obesity management medications, I do want to remind us the purpose of obesity medicine, and that is to treat the excess adiposity to help prevent and treat weight-related conditions. And we can achieve that by achieving at least a 5% total body weight loss. So that's where we start to see real health benefits. So for any obesity management medications, we want a minimum of 5% total body weight loss after at least 3 months on the max tolerated or max available dose. That's clinically what we are looking for. But many patients are wanting more than that, and for some medical conditions, we do need more weight loss than 5%. We see more benefit with 10 and then even more with 20. And many of our new generation obesity management medications, our GLP-1 medications, we do see 15 to 20% total body weight loss. So the first FDA-approved obesity management medication was Phentermine, and this was approved in 1959. This is a stimulant medication, so it's considered a controlled substance, although the abuse potential and misuse potential is very low. I always say you don't see people selling Phentermine on the streets. It doesn't have a lot of street value. It's also very inexpensive because it's been around for so long. We have it in a generic form. So even without insurance coverage, you can get this for $20 a month or less. The way that this medication helps with weight management is that it helps suppress appetite. And it's technically FDA approved for 3 months duration, but those of us who work in obesity medicine and many primary care doctors recognize that this really needs to be a long-term treatment because obesity is a chronic condition, and so it is clinically used longer than that, although I believe in some states it still is legally limited to just 3 months. You take this medication, it's an oral medication, you take it every morning, and the reason you want to take it in the morning is because it is a stimulant, and if you take it too close to bedtime, it may keep you up at night. The most common side effects are headache, dry mouth, palpitations or racing heart, typical stimulant, caffeine-like effects. Some people feel a little bit anxious, maybe a little bit of irritability, but most people tolerate it pretty well. If you are having side effects, it's important to know that there are slightly different versions of Phentermine. You can take a lower strength, or you can transition to another medication, diethylpropion, which is often tolerated better and can be dosed actually 3 times a day. So you can take it with each meal because it's shorter acting or shorter lasting. So that medication, diethylpropion, is also available. You do not want to use this medication if you have uncontrolled high blood pressure, a history of cardiac disease, like a history of a stroke or a heart failure or AFib. You do not want to use this medication if you have glaucoma or uncontrolled hyperthyroidism. Average weight loss with this medication is somewhere between 5 and 10%. Next generation, we have Qsymia, and Qsymia was FDA approved in 2012. Qsymia is a combination of Phentermine with topiramate. So it has all of the same effects as Phentermine, but then it has topiramate added to it. And what they found was that it has an additive benefit. And so on average, Qsymia is more effective than Phentermine alone, and people may lose 12 to even 15% of their total body weight on Qsymia. It similarly works at the brain level to control appetite. It seems to be a little bit more effective with that combination treatment. It is still considered a controlled substance like Phentermine, although the FDA approved long-term use of Qsymia, and so there are no limitations for prescribing in any state. The name brand for Qsymia can still be pretty expensive. There is no generic at this time, but there are some programs where you can get Qsymia delivered to you, and you can get it for $89 for a 30-day supply or a 90-day supply for $210, which would be $70 a month, and it gets delivered to you, which is very convenient. Sometimes physicians will also prescribe the individual components of Qsymia, so they'll prescribe Phentermine and topiramate. The doses are slightly different, but it can be a lot less expensive that way, and so that's an alternative option that you can talk to your doctor about. In addition to all of the contraindications and reasons why you should not take Phentermine, there are a couple additional reasons why you should not take Qsymia because of the topiramate that's in it. The number one most important is that topiramate is known to be teratogenic, meaning that it can lead to birth defects, specifically cleft lip and cleft palate. And so if you have any potential of becoming pregnant, then you should not take topiramate. You should be on effective birth control if you have the potential for pregnancy to prevent that complication. Topiramate can also increase risk of kidney stones, and so you want to make sure you're staying very well hydrated. At high doses, it can cause fatigue. It can make people a little bit sleepy, and sometimes people get an abnormal taste, which interestingly can be more prominent with carbonated drinks, so it can be very helpful for people who are looking to cut back on their soda intake. And then some people get abnormal sensations, often in their fingers or toes. That's reversible when you stop the medication if that does happen to you. Next, we have Contrave. Contrave was FDA approved in 2014, so 12 years ago now. And Contrave is a combination of bupropion, which the brand name is Wellbutrin, and naltrexone. And this is another oral medication, a combo medication, and it can really help mostly for food cravings and emotional eating. And so it can help break up the food reward pathway. Bupropion or Wellbutrin is often used to treat depression, sometimes anxiety or ADHD symptoms. It also helps people cut back on cigarette smoking. And then naltrexone is an anti-opioid. It blocks the opioid receptors, and it's most commonly prescribed to decrease cravings for alcohol. And so if you are struggling with mood or wanting to cut back on cigarette smoking or alcohol intake, then Contrave could be a really good option for you because it's going to have that dual benefit. You cannot take this medication if you have a history of seizures. Bupropion can lower the seizure threshold, so if you've ever had a seizure before, please do not take this medication. And you cannot take it along with opioids. That will make you very sick to take the naltrexone along with opioids. And I will also make a plug that the over-the-counter Kratom or 7-OH products, those are opioid products, so you cannot combine these two medications. It will make you have precipitated withdrawals and really bad flu-like symptoms. Contrave also is still under brand name only. To get the lower cost, if you do not have insurance coverage, there is a program where you can get it for $99 delivered to your home. And then similarly, the individual components are generic and your doctor can prescribe those to you to take together. And again, the doses are a little bit different than what is in the brand name Contrave, but could be a much more affordable option. Common side effects may be nausea when you first start the medication, potentially headache or palpitations. Bupropion can be a little bit stimulating, so some people, if you take it too late in the day, could keep you up at night. Some people feel a little bit of restlessness or anxiety, again, mostly in the beginning, but overall it's pretty well tolerated medication. So those are the 3 FDA-approved first-generation obesity management medications. They're all our oral options, and if you noticed, it took from 1959 to 2014 to get these 3 medications approved. That is not that many options over the course of many decades. Compare that to the last decade, where we've now had many GLP-1 medications approved. We have Saxenda, which is the daily injectable GLP-1, which is not commonly used because of convenience, and it's not as effective as our newer GLP-1 medications. We have Wegovy, we have Zepbound, we have oral Wegovy now, we have high-dose Wegovy, and we have Foundayo. And coming up very soon, we're going to have Qsymia and retatrutide and many more medications. And so it's a very exciting time in the field of obesity medicine. We have many options for patients, but I don't want us to forget our tried and true first generation options, because there are many people out there who do very well on those medications. And oftentimes we may do a combination because they work in different ways. You can take someone who is on the highest dose of their GLP-1 and they've done great, but they haven't reached their complete health goals. You may decide to add on one of the first generation medications, and that's okay to take those together. There could be other instances when cost may be a factor and somebody they can't afford to take a GLP-1 medication long term. Maybe we start with that treatment, wean off, and then maintain with one of our first generation obesity management medications. There could be reasons, maybe if there's a medication shortage, again, we have to utilize these other medications. It's good to know that there are many tools in the toolbox to treat this multifactorial chronic condition, obesity. I also want to give honorable mention to metformin. Metformin can, again, be used alone or in combination. Metformin does not control appetite. It does not control food noise. It does not impact fullness, but it does treat underlying insulin resistance that many, if not all, people who struggle with their weight have, and it can definitely improve metabolic health. Metformin is generic, it's very inexpensive, we've been using it for decades. It can be a great adjunct to treatment of obesity. So it's not technically an obesity management medication, but it is honorable mention, and I do use it quite a bit in my practice. So what are your thoughts? Have you tried any of our first generation obesity management medications? Is this something that you would consider adding on to your GLP-1? Let me know. I'd love to hear your thoughts, and I'll see you next week.